For almost 10 years, advocates have been trying to restore money from the state for dental coverage under Mass Health. Some of the funding has been restored, but Healthcare for All wants to see more progress on coverage for periodontal treatment. To tell us about the importance of that coverage is our guest from Healthcare for All, the Oral Health Project Manager, Neetu Singh. Thank you very much for being with us, Neetu.
Thank you for having me.
Periodontal work, that's work on problems with gums. Why is that so important?
So thank you again for having me. So one of Healthcare for All's longstanding priorities has been to ensure access and comprehensive coverage of dental services for children and adults in the Commonwealth, particularly for our most vulnerable populations.
Well, periodontal work, for instance, that comes into play when you've got a gum problem, and I guess if you don't do something about it, it gets worse and worse. You could lose all your teeth eventually if you don't do something.
You absolutely can. So just to provide some context here, periodontal disease is another term for gum disease. It's chronic infection of the gums and bones that surrounds teeth to keep them healthy and stable. Early stages of gum disease, which is called gingivitis, symptoms can be almost non-detectable and can go untreated for a long period of time. And when it goes untreated, the infection has an opportunity to advance and go below the gum line. It can cause teeth to become unstable, cause teeth to move, and eventually loss, which can be problematic for a variety of reasons. It's important to know that when you have more advanced stages of gum disease, the bristles of an average toothbrush are not going to remove that infection. So you really do need to go to your dentist to have a professional dental cleaning done. And so when you don't have coverage for this service, the chances of you losing your teeth are significant. And you know, when you're looking for a job or you're interacting with people and you're missing teeth, it can make you very self-conscious.
And the employers won't be impressed with you either, so that's another
exactly
problem
right.
in the mix. It also sounds as if if this gets bad enough, fixing it can be really expensive.
It can be expensive. Often, as I said, when you don't have the opportunity to seek appropriate treatment, you are more likely to avoid going to the dentist. You are likely to go to the emergency room to seek care
and that costs even more money.
And that costs even more money. When there was a policy brief that was published by the Health Policy Commission last year, which looked at emergency department usage specifically from an oral health perspective, and they found that the two most common reasons for preventable visits are oral health related. The first is inflammation of the dental nerve, where you would need to go to a dentist to have dental treatment done, root canal treatment. That is not the place that emergency rooms can provide appropriate treatment. And the second is inflammation of the gums. And again, you would have to go to see a dentist in a community setting, not in an emergency room, to seek appropriate treatment. And so when you are going to the emergency room, it's problematic because, one, you're not addressing the underlying issue. You're probably given antibiotics and pain medication, which doesn't solve the infection. It might provide some short-term relief, but it is not the long-term solution. And the other reason is that it costs the state a lot more money to provide care in an emergency room than it is to provide preventative, treatable treatment for patients.
This is BNN News. We're talking with Neetu Singh from Healthcare for All. Neetu, talk about how the gum problems can overlap with other health issues.
Sure. So as a general dentist myself, I've certainly had patients who, as a result of not receiving appropriate gum treatment, have had complications with the rest of their body. It's not hard to imagine if you were to have an infection in your arm, let's say, that it would travel to other areas of your body. The mouth is no different. I've had patients who have had difficulty keeping their blood sugar under control, their diabetes, because regardless of having good nutrition and exercising, they just were unable to maintain their diabetes under control because of infection in their mouth. Gum disease can also impact stroke increase your likelihood of having a stroke. It can lead to preterm birth and other pregnancy difficulties.
How does it lead to a stroke? I never heard that before.
It can aggravate the symptoms of inflammation. So if you already are stroke prone, it increases your risk of having an additional event.
What about racial disparities? Is that a factor also that we have to be looking at?
Sure. Minority communities are generally disproportionately more likely to have some of these medical conditions, such as diabetes, heart disease, and stroke. And so when there are barriers in place, such as coverage or cost issues, which again also disproportionately impact minority communities, it's just sort of a double whammy, so to speak, where communities of color that are more likely to have medical conditions and then are unable to seek care, it's just more compounding for that population.
Well, what you're trying to do right now is to get some relief in the budget. So how much money is this going to be?
So the last time that periodontal treatment was covered in the state was in 2002, and at that time it cost the state roughly $6.7 million. 7 years later, our estimate is that it would probably cost us around $10 million to provide the treatment. That in the long run does produce savings on the medical side. We've been working with Representative Syback to file an amendment to the state budget. So we encourage viewers to call their House representatives in their districts to let them know that this treatment is important. The more support that we can generate for this amendment, the more likely it is to be included in the final House budget, which we expect to be available at the end of next week.
Of course, as I mentioned earlier, there has been partial success with restoring money for dental care. Talk about the importance of even getting those other kinds of dental care, because, at the very least, every so often you go in there, someone's telling you about brushing and flossing and explaining the risk to you. I'm sure that makes a difference in some way, doesn't it?
Absolutely. I mean, for the most part, many oral diseases are preventable and treatable, so it's important that patients are going to their dentist on a regular basis, much like they go to their physicians on a regular basis for an annual exam, to sort of keep ahead of some of the oral conditions that can cause problems later on. So, we're thankful at this point that many services have been restored, but we still have a lot of work to do to make sure that we have comprehensive dental coverage, which is not the case at this point.
I should mention, if people want some more information about this campaign and other things at Healthcare for All, you've got a website that they can check out?
We do, absolutely. It's hcfama.org.
Thank you very much for being with us.
Thank you.
Neetu Singh from Healthcare for All. We'll have more news in just a moment.